Welcome to Embracing Autism IRL. Today we're sitting down with occupational therapist and pediatric feeding specialist Cuyler Romeo. Her extensive leadership and clinical experience are instrumental in the execution and management of Feeding Matters strategic initiatives. In partnership with the CEO, Jaclyn Pederson, Cuyler collaborates with constituents to identify, track, and assess innovative approaches to the PFD system of care. Cuyler also facilitates strategic partnerships with select professional associations, including the American Occupational Therapy Association. She is currently a treating clinician at Banner University Medical Center's NICU and works to advance the feeding skill domain by facilitating AOTA's mealtime occupations, feeding, eating, and swallowing community of practice. Welcome, Cuyler. How are you doing this morning or evening, wherever you're at?
I'm I'm doing great. I'm so excited to be here. Thank you for having me.
Awesome. I wanted to first start off by asking you if you could just tell us a little bit about yourself and your relationship with autism.
Sure. Well, I kind of wear two different hats. My clinical hat or my clinical trade is that I'm an occupational therapist and I have specialized in feeding, eating, and swallowing since my clinical work. So I've worked in a variety of areas for feeding, including inpatient, acute care in the NICU, which is where I'm working currently, but also in the pediatric intensive care unit, the PEDS floor, outpatient therapies. I have served as a partner and started my own outpatient feeding clinic to serve Southern Arizona. And then I've also worked in home health, where I've gotten to really see the child where they live and where the family's at. And I've worked in early intervention as well. So that's kind of like the clinical side of me. But the business side or the system change side is what I'm lucky enough to be able to do with Feeding Matters. And Feeding Matters is focused on changing the entire system of care for all children who struggle to eat. It's just a beautiful marriage of being able to take some clinical knowledge and bring it to an organization that uses that as like one tool in their toolbox to really change the world and how people view kids and families that are struggling to eat.
Yeah, that's fascinating. I know that in the autism community, eating is definitely an issue. It's something that we talk about a lot and it's something we struggle with our kids. I honestly have struggled with it. I don't know if you are aware, but I had an autism diagnosis as well, and feeding was always one of my issues growing up. So I know that there's some kind of like buzzwords that go around that our audience may or may not be familiar with. One of those is pediatric feeding disorder or PFD. I was wondering
Mhm.
if you could maybe define what that is and maybe talk about how it might be particularly relevant to autistic children.
Oh, absolutely. People may not be aware of this definition because it's a relatively new term and a new diagnosable condition. Feeding Matters started way back in 2006 with a parent who had three triplets that all required gastrostomy tubes in order to receive their nutrition. And they struggled and struggled to improve their feeding skills so that they could transition off their G tubes. And it was that parent that founded Feeding Matters. And then it grew into this international organization with deep seated roots back into the family story, the lived experience, and family care. And it was that parent, again, who brought forward the need to have a diagnosable condition. Because, like you said, like you yourself as a child struggled to eat, and so many people struggle to eat across their entire lifetime. But without a way of describing it or giving it a name, it's very difficult for the medical side to research it, to document what that person is having challenges with and what's being done. So it's really hard for us to know what works for who. And that's why Feeding Matters facilitated and funded a group of experts coming together to define this condition. And after 2 years of work and a labor of love, that consensus group that included family members, OTs like me, speech therapists, GIs, people from all over healthcare, they all came together and were able to define this condition. And what they called it was pediatric feeding disorder. And so that definition wasn't even published until 2019. And that's why many people still have never heard the term pediatric feeding disorder. But if you want to say, like, in layman's terms, what is a pediatric feeding disorder? It is when a child is unable to orally take in their needed nutrition for their health, growth, and development, and they're not able to do so in an age-appropriate manner, and that lasts for at least 2 weeks or more. Then that is associated with challenges either that are deep-rooted in medical complications. It could be rooted in feeding skill delays or deficits. It could be due to nutritional issues, or it could be psychosocial. And so if you have a challenge in any of those 4 areas that's resulting in you not being able to eat what you need for at least 2 weeks, then you may qualify as having a pediatric feeding disorder.
Does that have a diagnostic code, or is that still kind of like new, or, where in the medical field would you find that?
That's a good question, because that's really what's needed, right? In
Right.
order to get a diagnosis to hold some ground and then be able to be coded so it can be tracked, is it does need an ICD code, or what we use in the US is the ICD-10.
Right.
It's labeled something different internationally. But yes, our next step was, after we got the publication, was then to go to CMS and to start an advocacy campaign and lobby to get an ICD-10 code. And we did receive an ICD-10 code. And so now it's under the R codes, which is signs and symptoms. It's R63.3. And what that new code did is it really replaced the old code that we tended to use in healthcare, which was feeding difficulties. I remember seeing that coming through on every chart of the kids that I worked with. Everybody was just labeled as having feeding difficulties, which is so non-specific. That doesn't tell anyone about that unique condition or what that
super vague.
Like, a feeding difficulty to you versus to me is going to, be represented quite differently.
Yeah, that's true. That's awesome that you guys did that. I remember a couple years ago reading something about that in the news, and I was curious about it. That's why you guys piqued my interest. So what I have heard about in the autism community has been more around the topic of ARFID.
Oh,
And I know people are more familiar with that as the avoidant restrictive food intake disorder. So a couple questions around that. How does that differ from PFD?
mhm.
And how is it diagnosed in autistic individuals? Is there anything that parents should be on the lookout for?
That's an excellent question, because you're right. Pediatric feeding disorder, as well as ARFID, is more prevalent in children that have autism because of other related issues, whether it's with GI or if it's with their interpretation of food and eating experiences. So they're going to be more prevalent of having these conditions. So it's really good to have a working background knowledge. ARFID there is overlap between the ARFID diagnosis and how it's described with PFD. But what sets them apart is that pediatric feeding disorder includes the medical domain and the feeding skill domain. And that is not represented in ARFID. For someone to be diagnosed with ARFID, they would need to be diagnosed by a psychologist or someone who works in the mental health field, because it is a mental health diagnosis. It's in the DSM-5 as far as its diagnostic criteria. And a person with ARFID has difficulties in eating a variety of foods to the extent that it causes weight loss. It can cause malnutrition, or a person to rely on supplements. Maybe it's Pediatric, it could be protein shakes, it could be any nutritional supplement. And then it may also be associated, most commonly is associated with psychological concerns as well. It interferes in how they're functioning psychologically. But the way that we like to describe it is, if you think that pediatric feeding disorder has 4 domains: medical, feeding skill, nutrition, and sight, ARFID has 2 of the 4. It has nutrition and psychological differences in its diagnostic criteria, where PFD also includes medical difficulties and feeding skill difficulties.
Wow, okay.
It's the big
That's
difference.
yeah, but there is a nuanced difference there, so I do see how, it could be one and not the other. Um,
Mhm.
kind of along those same lines, a lot of autistic kiddos, adults alike, struggle with sensory processing
Yes.
disorder and sensory regulation issues. And people who are neurotypical might not be aware that sensory is heavily involved in eating and feeding. To everyone else, it might just feel natural, second nature. But to autistic individuals, you really do feel the impact of the sensory system. So my question for you is, how do you see sensory processing difficulties in autistic children impacting their feeding behaviors? And is it possible to share some common sensory related challenges that
Mhm.
you have seen?
Oh, absolutely. I mean, first we kind of need to span out and look at what meal times are. And meal times are so sensorially rich. If you think about just the smells that are associated with meal times, and if you are more sensitive to smells or you're a super smeller and you're embedded into the kitchen or a mealtime experience, what I may interpret as being pleasurable to you could be interpreted as being completely noxious. And that is part of every mealtime. That's part of food. If it is cooked at home or if it's more organic in nature. So, smell is only one aspect of a mealtime. Then you have to layer on the visual, all the different, how foods look completely different, how it looks when people are eating, how it looks when food is falling out of someone's mouth. What if somebody's not being clean? Then all the sounds associated with food, the scraping of the forks, the chewing and the smacking. And then you have to layer on top of that how it actually feels in your mouth. That is layer on layer on layer of sensory processing, and then adding in your past experiences, and you get this big perceptual picture that can be really challenging for people when they do not have positive associations to food, or they are sensitive or more responsive to foods, smells, tastes, and textures. And that is more common in kids that are on the spectrum, that they have a different sensory interpretation. And we need to understand how they interpret food. That to me feels like the first step, because what it can look like is avoidance of mealtime. If all of those things are noxious to you, why on earth would you want to sit at the table? Right? If it's hard for you, let's say what really bothers you the most is sound, is the sounds associated with meal times. Perhaps you are able to eat different flavors and textures, but you cannot manage the sounds. Would you want to eat in a crowded cafeteria at school where there's so much sound overload? No, you may eat perfectly fine and be able to meet your nutritional needs, but you may need to be eating in a more isolated environment, or you may need to eat with a sound that is soothing and positive to you rather than noxious. So sensory sensitivities can present so many different ways because it's individualized. It depends on that person and how they interpret that unique circumstance. And then what makes it more challenging is that it changes day by day, depending on what's happened in the morning, right? I don't know about you, but there's some days that I'll be really brave and I can eat a new food or perhaps something that's not my favorite if someone makes it for me. But on days where I'm stressed, I don't want to eat that food that's not my favorite. I want to eat my favorite food in front of the TV with my cozies on, and that makes me feel good and nourished. So it also changes depending on what's happened in your day.
It's interesting that you say that because a lot of times autistic individuals are under a higher stress level than neurotypical people because of all the sensory stuff. So it might be that, they're asking for their favorite foods more often for that reason.
Mhm.
It's also funny because our kids, so we have 2 autistic kids. One
Mm.
of them is the type that always runs away, and
Mhm.
so we have a really hard time having her stay seated at the dining room table, and the other one is the type that seems to have that auditory sensitivity, which we
Wow.
never noticed at home, but once she had lunchtime at the school cafeteria, over
Mhm.
there, they say that she'll, like, throw food, she'll start, like,
Mhm.
taking items off her plate and stuff, and we realized that it was the sensory overload, so now she has to wear her earmuffs at the cafeteria, but we never would have associated that with feeding.
Mhm.
So it's
Right.
interesting how much plays into it.
Yes, and how you have to really break it down and look at all those different elements, because avoiding the table is just one expression that you're having challenges with eating. It can be, like you said, wanting to eat particular foods. Processed foods are a lot easier to eat than organic or natural foods, because organic and natural foods change. Like an apple I eat today is totally different than an apple I'm going to eat tomorrow. And those subtle differences are huge differences to some people. So it can be in what foods they pick. It can be specific textures that they like or need. It can be how things smell. So every sensory aspect really needs to be broken down so that we better understand what people need in order to be nourished. Yeah.
Yeah, absolutely.
Mhm.
I also wanted to ask you because so our kids have gone through both occupational therapy, they've also gone through speech therapy, and I know that there's some overlap when it comes to feeding therapy between OTs and
Mhm.
STs. So I was wondering how does that relationship kind of differ? What is it that the occupational therapist is doing that's different? How's that approach with feeding challenges really determined on that side of the thing?
Mhm. Well, you're right in identifying that the two primary disciplines that you see at work in feeding skill domain are occupational therapists and speech language pathologists. And either of those clinicians can work with feeding, eating, as well as swallowing, if they have the specialty training. Now, I have to tell you, none of us leave graduate school with enough education to hit the ground running and be a feeding specialist. It really does require postgraduate education. So it's really important that families dive in and talk to their therapist and ask those questions of, what is your training? What is your approach? How do you determine to do A, B, or C? Like the parents often are leading the fight and being the advocate for matching the best provider to their child. Um, I wish we were in a world, right, that where we had a formalized pathway of education so that we could guarantee a certain level of knowledge when you have a clinician working with your child, but we're not quite there yet. But I can say OTs and speech therapists both serve this area. Um, an occupational therapist, when you look at our training, we're a doctorate level degree now. That was a change that happened a few years ago. But we take a holistic approach to care. That's the basis of occupational therapy. We say we do all the occupations of living, which can apply to anything and everything. But it's very holistic in nature. So it's looking at the entire unit, and for a child that's eating, a young child that's eating, that's the dyad. So that's the parent and the child. And in my eyes, that is one client, the parent and the child together, not just working with the child and talking and educating the parent, but the parent and the child have an intricate relationship with food. And so we're going to treat them as one holistically.
So when it comes to that feeding therapy, then from an occupational standpoint, what are some of like the common techniques or methods? What is it that a parent could kind of expect if they were seeking feeding therapy from an OT?
Okay. It will depend on your child's age and their developmental level, as well as other aspects that are evaluated during an assessment. So when an OT is looking at a feeding assessment, they're going to assess feeding skills. That's like your oral motor skills, your sensory tolerances and interpretation of food, as well as that child's gross motor skills, their fine motor skills. They're going to be looking at language, cognition, and then the entire mealtime experience. I think traditionally we think of OTs fitting into being pigeonholed into sensory, right? We hear a lot of OTs working in sensory desensitization, sensory tolerance. But what we're learning is that mealtime is not just the sensory properties, but it's also how we interpret body sensations. It's introspection. It requires functional oral motor skills. It requires safe swallowing. It requires mealtime skills. So I think as we learn more about what kids and families need, I think we will see more clinicians embracing a holistic approach where it won't necessarily just be OT is looking at sensory and then we think of speech as doing swallowing. I really think we need comprehensive education in order to treat that child optimally.
Yeah, I definitely think so. I know, like, when our kids were diagnosed, we were blessed with being able to go to a facility that had, like, a four-person panel
Yeah.
diagnosing them. So they had the ST, they had the OT, they had the developmental pediatrician, and then a social worker. So I definitely think that's the future. I totally agree with you.
Mhm.
I know that from your background, you mentioned that, you have that NICU work under your belt. So I was wondering, what I know that autism diagnoses tend to be done a little later in life. So I know it's not something that you would necessarily see in the NICU, but I was wondering if there's any correlations or anything that you have picked up or you've read about in any research or anything that show any sort of link between early feeding challenges and autism.
Mhm. Well, autism can be related to other medical conditions. It's more prevalent in children that have like Down syndrome. It can be more prevalent in kids that have seizure disorder and some other chromosomal disorders. So there is that correlation between autism and other conditions that are then related to difficulty coordinating suck, swallow, breathe from early infancy, or perhaps a baby that can't that doesn't have the adaptation skills to transition from breast and bottle onto a cup or onto a straw. And then we also tend to see more incidences of formula intolerance and other GI concerns such as reflux, constipation. We know it's associated with food allergies and other functional GI disorders, and all of that can be seen in the early months typically if you know what to look for. So I would say if you have a child that has struggled to eat in any way, even in early infancy, the sooner that you can bring that to the attention of your pediatrician and have a more comprehensive assessment, the better the chance we have of preventing it turning into a pediatric feeding disorder or a feeding disability later on.
So, what would you say to the parents who perhaps missed that early window? Let's say that they are seeing these red flags in their kids. What would you recommend their next steps be?
I would say you are not too late. So, one, like give yourself grace that you know your child best and that you're working and do everything in your power to support and love your child. So, give yourself grace on that end. And the next step is to bring it to your pediatrician or to a pediatrician that will listen to your concerns. Now, we do hear quite a bit from our families that concerns may not be heard from their physician. And we can help equip parents with the right language to have more powerful conversations. That's one option. We have an infant and child feeding questionnaire that's free on our website, and it takes you through a whole series of questions, and it prints out this really beautiful report that you can print and take to your doctor, or you can email directly. So you have a guided conversation with your doctor to bring those concerns forward. Or if that physician isn't the right match for you, seeking a second opinion. Because if you have a concern, then there's a concern. If you feel like there's a problem, there is a problem.
And for those of you on audio only, that link is questionnaire.feedingmatters.org for the form that she was mentioning where you can identify those areas of concern. Um, so again, a lot of these kiddos, they may or may not be diagnosed with autism. They may or may not be diagnosed with some sort of feeding disorder. A lot of times that brings up a lot of like anxious feelings in parents, but at least it feels like there are some things that you've mentioned that they can do, some places that they can go. So that's something positive for our listeners to hear. But I feel like there's probably some stuff out there that might be looking into this now that it's becoming more prevalent. It seems like now with the PFD being identified that clearly there's more importance and emphasis being put on this and more research being put out there. I was wondering if you happen to know of any new developments coming around that may be associated with feeding therapy, or any new discussions around PFD or RFID that might be
Mhm.
helpful in the future, or if you see it kind of going anywhere.
Mhm. I feel like we're always learning more about the brain gut connection and functional GI disorders. So I stay up to date on those publications, and I feel like we are making some good progress and better understanding um, GI GI introspection, as well as food tolerance, and how that affects the development of feeding skills, as well as the development of cognition, as a larger aspect. So I would encourage people to continue to read the literature. Um, Secondly, I have something really exciting to report from the Feeding Matters side, which is recently we were awarded a patient-centered outcome research grant. And what this does is it allows us to form a family consortium. So this is a consortium of family members that have a lived experience of either having a child with pediatric feeding disorder, or they themselves identifying as having a pediatric feeding disorder. So we've been able to bring these people together, and they're establishing their governance right now. That currently they're in a governance and education phase. But what will occur within the next year is that this group of individuals will decide what they think is important to research. So instead of research just coming out of academia or medical institutions, now the families themselves will bring a research agenda to the academia and to the medical institutions, so that what we're trying to investigate is more pertinent to what people need to know and want to know based on their lived experience. So that to me is just a huge win for families as far as where research is going in the future.
Yeah, that's pretty awesome. It's really great to see when families get to be more involved in these sorts of things. We get involved in research
Mhm.
all the time in our local area because we find that it's so important.
Mhm.
So what are some of the areas that place where are some of the areas that the audience can follow you and get more information about this research,
Mhm.
or if they're able to find more information about what you guys do at Feeding Matters, or any other additional resources that you might have available for them?
Oh. Well, the first place they can find us is always online. That is our where we live digitally. They can visit us at feedingmatters.org, and that's our primary landing page. And if you go onto the website, you'll see that there's tabs that talk specifically about what is PFD, and a tab that is what is RFID. And then we have a new landing page that talks about navigating the overlap, because there is so much overlap in between pediatric feeding disorder and RFID. And we just want to ensure that if you're diagnosed with RFID, or your child's diagnosed with RFID, that you feel confident you have ruled out a medical complication. Because back to what you were asking about as far as research, if there is an underlying medical complication or GI disorder and it has not been unearthed, that child is not going to be able to make progress. So we really implore families to rule out medical, and also ensure the feeding skill looks good, that they have the skills they need to eat a variety of textures and do that safely. They also can follow us on Facebook, on Instagram, on Twitter, of course. And we are going to be launching It Is Not Picky Eating campaign, because we really need to nip this in the bud that people are calling this, oh, it's just picky eating. It
Oh,
is not.
that is so frustrating. That is like one of our biggest pet peeves.
So join our voice. We're going to be launching that, and you will see tons of PR and updates to the community. We wear shirts all this time. I'm buying them for everybody in the NICU on my unit. So we're going to be wearing It's Not Picky Eating shirts.
Oh,
So families learn about this early, but we just really need to make an inclusive community, because food is hard. Meal times are hard. And we recognize how difficult and how challenging it is. And it's something that can last a lifetime. So we really need to come together and see how we can create an environment where food isn't so hard.
And I think that is like so validating for parents to hear, because I cannot tell you how much grief parents get for their kids picky eating. Um, Before we end this, I would love to ask you, I ask everybody that I speak to, what you think the phrase embracing autism means to you personally.
Oh, I love this question. It's such a good question. Honestly, I hope that my answer continues to evolve as I work with more families and I'm exposed to the lived experience at a greater depth. So I hope if you ask me this question next year, I'll have a different answer than I have now. But to me, I think embracing autism means to endorse and not to accommodate. That's really what kind of rings true to me is that we all want to be successful and we all want to live a rich life, and everyone has the right to do so. So how do we understand and create an environment that really celebrates diversity? Because I truly believe diversity is necessary for a healthy society. So I would say, like, let's endorse and not accommodate. That would be my answer today.
Well said. So thank you so much for joining us on the podcast today. For everyone listening out there, just a reminder, you can follow Cuyler and Feeding Matters at Feeding Matters on Instagram and Facebook. The website is also www.feedingmatters.org for more information. And again, that questionnaire is questionnaire.feedingmatters.org for any of you looking for that extra resource or a little bit more information. Thank you, Cuyler, so much for joining us on the podcast. I appreciate you coming.
Thank you.
Have a good one.